Guys, welcome back to Medical Coding with Blue. Today's episode is about me, what I do as a medical coder, where I work, and what are some of the tasks that I do. So with that said, if you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay guys, so we're talking about me today. A lot of people are asking me, Blue, where do you work? What do you do? Tell us about yourself. So here we go. All right. So I began my journey in 2008 when I became certified as a certified coding associate. I got my first job with a temporary agency, and that was at the Cancer Therapy Research Center. Was my first assignment. I was there for 3 months, and then I got another assignment from the temp agency to work at a hospital that required me to move away from my hometown. And I started working working with inpatient professional services, basically making sure that the provider gets paid for their professional service for outpatient in a bed, essentially. So the patient is inpatient, but is following outpatient rules, the whole thing. And so I did really well at that position. I put it on my resume, sent my resume out, and I got hired at my now forever home to code for inpatient professional service. And I stayed with that service for a couple of years, and then I got shuffled around a bit because inpatient professional service gives you a lot of exposure to different specialties, so that was never an issue for me. I coded for behavioral health, and then I coded for urology, and I coded for physical therapy. And then I finally got put into orthopedics and podiatry, which is who I code for presently today. They needed a full-time coder, and one of the coders that was coding for those two clinics was leaving, and so the partner for that clinic needed somebody to be in there. So here I am, you know. So I get in there, and then of course we have the ICD-10 CM, ICD-10 PCS changeover in 2015, and we're all learning around that time about ICD-10. We're transitioning from ICD-9, and then we moved into the big beautiful new hospital that we got in 2016. And so we were able to be embedded in the clinic because we had been housed away from the clinics in this ancillary building because there was no space for us in the old hospital. And so with the new hospital, we were able to, be in the clinic and see the providers and have that interaction with them and things like that. So that was a really great experience. I grew a lot from that, just being around them, getting to know them, and it made the whole process of education much more easier. All right. So I have been given a few other assignments in the meantime. I had been put into the pulmonary clinic, and also neurology and rheumatology to help them out. And of course I got sent back into ortho because I had still retained podiatry, but I had just been out of ortho for a little bit just to kind of rescue those clinics. And I did my job, and I went right back into ortho. And so it's been ortho ever since then. And I work with my providers, being embedded in the clinic. It's good to see them, and interact with them daily. So anything new that comes about, any new staffs that come along, I'm right there. I send out a coding tip of the week. I try to do that consistently. Sometimes it's impossible because we have, other trainings and things going on. So sometimes that stuff kind of gets on the back burner. But for the most part, I try to keep up with them about at least once a month or so, giving them a coding tip of the week. I try to make it consistent, like I said, but if I can't, I try to at least make it once a month, But in this coding tip of the week, it's just a brief message just to kind of let them know, hey, I'm here if you have any questions. And I tell them about a trend that I'm seeing in their documentation. I never call out a provider for doing something bad on a email to everybody, because that's inappropriate. The great thing about having my own office in this space in the clinic is that there is a place for providers and me to have one-on-ones that no one has to hear what's going on, and so you always want to be mindful of that you're not going to embarrass a provider or anything like that. I always mindful about those things. because it's important. They have so much pressure on them as it is, these surgeons and even the PAs. They have lots of pressure, and to have another person, scolding them is not ever a good thing. So I try to be mindful of that. I try to work with them and pay attention to how they learn, so that way I can tailor my education to them and basically speak where they're going to be able to understand. If they're a visual learner, I'm going to have lots of visual aids. If they are more of like, okay, just give me the bullet points, I can do that too. And so, it's just a matter of just pivoting where you need to when it comes to building these relationships with providers. The better your relationships are with them, the better the documentation will be. I don't have to do a lot of queries unless the provider is new, and at that, if a provider is new, I will meet with them one-on-one before they start seeing patients in the clinic, introduce myself. I will bring them a little welcome packet, which is an evaluation and management tool. They'll get one that's laminated. I brought my own laminator machine so that I can laminate in colorful paper the evaluation and management tool so that they can have it for their reference. I also make copies of other just clinic general guidances that we have there in the clinic. So that would be helpful for them. And I have a little paper that says all the things that we talk about, and talking about evaluation and management, talking about the global the global days. I talk about that with them as well. And then I have them sign a copy and I sign a copy, so that way there's no question about who, no one told me. Yes, we talked about it and it's here and you signed it. I do that, and I've never had an issue with anybody signing on me. So that's good, knock on wood, obviously. But it's just, it shows a different side of coders when you have somebody who's so willing to go and talk to them, because a lot of them say, I've never had a coder come and talk to me like this before. And a lot of them have come from facilities where they have lots of coders, and why that doesn't happen, I don't know. But every coder is going to be different, and every coder's response to, setting up relationships is going to be different with these providers. Some coders refuse to speak to their providers, and I am not that way. No, if anything, I'm going to make sure that they know who I am, and they're going to know that they can reach out if they ever need support or anything like that. And my supervisor knows it, and a lot of other leadership knows that about me. And so I'm very proud of that, because it takes a lot. It takes guts to be able to talk to some of these providers who can be very intimidating. But you learn to be a professional. You learn how to handle your responses and your emotions and things, so that you can get your point across in a professional way. And I think that that's always a good thing, And let's see, what else? So I start my day with running a report for all of my providers for orthopedics and podiatry, and all of their encounters that they did on the previous day is what I'm looking at first. And so I work through those encounters first, and then once I'm done with those, then I'll go back and see if there's anything in the backlog that I need to tend to right away, and then, or if there's any queries that I've sent, then I'll take care of those as well. And then after that, it's the end of the day, because it takes me just as long. We did get a new electronic medical record system, and it is taking everything for us to learn. There's a lot of different things that are completely changed from what we used to have. And what we used to have was obviously a lot more efficient, but this one is a little bit, there's a few more steps and a few more clicks that you got to go through. So those clicks and those steps take time, so, but it's something that we'll just eventually get used to anyway, right? So, like I said, I do that. That's what I do. Sometimes when they do put me on the calendar for provider education, what I do is I will typically get 1 hour. I will typically get 1 hour to do provider education. And I will make a slide deck with 10 slides. 10 slides, no more than 10. 10, the max is 12. And 12 is because it's got the additional information on it and stuff like that, like references and things like that. So that's the only time, like 10 slides is what I'll have in this slide deck. And I print them out only because I don't trust the projectors. A lot of times there's always an issue. People can't get connected, and all of a sudden there's an issue, and then all of a sudden we're just standing there, on your hands like, okay, what do we do? So I always go prepared to these classes. I always make sure that I have copies for everybody. I make an assign-in sheet so that way people can't say, hey, I didn't get training, because yes, you did. Your signature's right there. And so they sign this sheet, and I take it back with me. And we talk about these 10 slides, and I always have the providers read to me these slides, because I don't read slides. I tell them, I know what I wrote, but I'm going to let y'all go ahead and read these. And after you get done reading one slide, then I can pick somebody, or you can just start speaking, because we'll talk about each slide, and that takes up the whole hour. Trust me, even though you think, oh, wow, 10, 10 is not enough. When you are trying to do education for providers, you really want to stick to 3 subjects. 3. And in those 10 slides, you're going to cover those 3 subjects. And because that's all the attention span these providers got for you. And if you don't make it a dynamic presentation from the time you start speaking, then they're going to lose interest really quickly. This is why I make them read to me. Because you ever been in a class before and somebody else is giving the class, and then all of a sudden you see people nodding off because there's no thing about engagement. The person is just sitting there just waiting to be taught by this person, and the person is up there doing their presentation like they should, right? But there's no engagement with the audience, and unless they're asking questions or something, they don't play a part. So I want them to play a part when I'm giving these classes, because this is going to make them be included. And now they have to stay awake. Now they have to be like, okay, well, I gotta pay attention, because I don't want to be called on, or I don't want it to be my turn, and then all of a sudden everybody's looking at me. So they do really well. So one person starts, and then they just follow around the room. They're very organized that way. So I'm okay with that. I just want them to read to me. So they read a slide, and we stop and we discuss it. So I will talk about more in detail some of the things that of course I didn't include on the slide, because when it comes to slides, what a lot of people don't seem to understand about slides is that it's just meant to have very limited information. And I don't put all these like cartoon characters on in pictures and things like that. I don't do that, because to me, that's not the place for this. This is about education, and I'm the teacher, and I'm the one who's going to talk to you about this, and this is what I want you to pay attention to, not a little picture, or not get distracted by something else that's on the page. That's meant for informational purposes. We're having a conversation, and that's what those PowerPoint slides for me are about. So we're having this conversation about, okay, this is what I've seen, this is what, this is how we can remember this. And then that usually gets people to start asking questions, which is really great. And I like seeing that. I like when people start saying, okay, we're having this conversation. And it's an awesome thing when they start raising their hand and go ahead, and so then they'll say whatever their question is, and so it's fun. I like that. And sometimes in these classes I will have snacks. Most of the time I will. I just bring a basket in, and what I do is I want to sneeze so bad. What I do is I'll bring in like Rice Krispie treats and just like things that I get on sale and stuff like that, and I put in this basket, and then I just leave it there. And the great thing about the basket is, and I call it my bear trap, but the great thing about this, I really want to sneeze so bad. The great thing about this basket is it's a bear trap. Everybody calls it the bear trap at work, but it's like breaking bread together. So if people start having a snack, then it's just like they're just, your brain can't be anxious and nervous if you're eating, right? And so that's where people relax and they start joking, and then the stuff starts to sink in, but I do that. That's what I do. Not everybody does that, and it's certainly not a requirement, but it's just something that I do. And I think that like I said, it helps to get that conversation going, And so then we just talk about whatever other concerns that they have. And it's great because, like I said, sometimes they won't ask you questions while they're in a class, but you see that look of question on their face. And so then that's when you could swing by later and talk to them. And that's what I do. I'll make myself available. Oh, oops, I'm walking down this hallway. Oh, hi, how you doing? And so but it works out, they get to ask their question and they don't have to ask in front of everybody. And, that's what I do. And so those are my most favorite days when I get to do provider education. And if I could do provider education every day, I would, because I think it just gets more of that conversation going. And I think they enjoy it. At least that's what they tell me anyway, And so other things that I do at work, I attend meetings. We have monthly coder education meetings that I have to attend in order to get my CEUs. That is provided to us by my employer, and that's great. It's always good to get free CEUs and stuff. I will also attend other meetings, especially because we have this new electronic medical record that we're going into, so there's trainings on that. I do have other trainings that I have to do, like for HIPAA and things like that. So those types of trainings, because you have your continuing education that's not just with your credential, it's also with the facility. Everybody has to have that same training. It's for safety and things like that, for HIPAA and those types of things, for fire drills and things. You have all of that training as well. So I'll do those trainings. Let's see, what else do I do? And that's pretty much the bulk of it. That's pretty much the bulk of what I do. But I code most of the day. 90% of the day, if I'm not in meetings, I am coding. I am there at my desk reading all day long. And some of the things that I read are very fascinating. Some of the things that I read are okay, I gotta look that up because that doesn't make sense to me. And now, okay, I get it now, And if I get really stuck on something, I know that I can walk down the hallway and there's a bunch of surgeons and there's a couple PAs that I can go and ask, hey, I have a question. I found this and I found this. What does this mean? And so, especially with my PAs, they're really awesome about answering these questions. So I'm very lucky for that, And but yeah, that's the bulk of what I do. And like I said, I enjoy it. Whenever I have gone to conference in the past, how you get the swag stuff and things like that. That's what I'll bring back to the office. And what I do is I use that as my grab bag. So whenever I do a class, whether it's for the providers or for the coders, because I've done a class for the other coders before too, I will bring the bag. And then what I do at the end of the class is I'll say, okay, I'm going to ask questions now. And if you can answer the question, then you get to pick from the grab bag. And of course, everybody gets excited about this. And it didn't cost me anything, because all it is when you go to conference and you're walking around and you're collecting the swag, you get all kinds of crazy looking pens and those little stress balls that you can, squeeze, and you get all kinds of neat things, little neat gadgets and stuff. And so I always put them in there, and then I just take it to work with me, and that's what I have there for them. And so they enjoy that, and that's also what brings that conversation out. So I'll do that. My supply is getting low, obviously. So we'll see. People are asking me too, are you going? I don't know yet. So this year, AHIMA is having their annual conference in Baltimore, Maryland. So if you're interested in that, check out the AHIMA website. It is going to be in October. So, if you go, that would be great. It's a great experience. It's a great learning experience. There's a lot of educational opportunities there. There's also professional development. Every year that I had gone, they've always had where you can get your headshots done, right? You can dress professionally. And I had never done that because I never really thought about it. And back then, because keep in mind, the last time I went to conference was in 2019. That was the last time I went to conference, and that was up in Chicago, because of course then 2020 hit in the pandemic, and nobody was doing it then, And I just, the following year, it's and so But like I said, so from that time, they had all kinds of things. They had like little workshops and seminars on, just business presentation and things like that, how you can present yourself better, as a professional. And so that's always a great thing, But yes, straying a little bit from the topic at hand, but it all ties in together, because when you go to conference, and when I've gone to conference in the past, I've always brought back my knowledge with me. So anything that I learned, I would tell the other coders that wanted to know about it. And there were some that they don't care, they don't care to know. But then there was others that were really interested to know what I had learned. And so, I mean, I'll share. I don't mind sharing information when I learn it, So, but yeah, that's what I do. That's what I do. Another person asked before if I would demonstrate on, how I code, and then just cover up. No, y'all will never see that from me, like how like coding an actual chart. Never, because it's just too dangerous, for like HIPAA reasons and concerns. And even though, oh, we'll just blur it out. No, because there's always people that can unblur those things, and then all of a sudden you got people's information out there. No, I don't think so, and you won't catch me doing that. So, but yeah, that I won't do. And everybody has different electronic health records. People have asked me, do I work with Epic? I have never worked with Epic, and a lot of people have. It's just at my facility we don't use that. And so every place you go is going to use a different one. There's Epic, there's Cerner, there's eClinicalWorks. There's lots of different ones. There's even smaller electronic health records for like smaller practices and things. So it really all depends on where you're going. If you're out there and you're wondering, oh, should I get this training or that training? Don't panic, and don't, get yourself training for something that you may not even need, right? Because every facility is different, and every facility has a different package when it comes to their electronic health record. So you can have 3 hospitals who all use Epic, but they have different packages. And so it's going to look a little bit different for each one. So that's just something that you got to keep in mind when you're out there. And so it's in the grand scheme of things, the electronic health record is a very small portion of what you got to know. Up against everything else, that coding has got to be the number one thing that you've got to really pay attention to and learn. I'm just saying. So with that said, I'm going to go ahead and wrap this one up. If this video helped you, although it's just about me, so I don't know. But if it did, please like, subscribe, and share it. I'll see y'all next time. Bye.